One community doctor calls it revolutionary, a machine that listens to your liver. You'd be surprised how much it can tell you and your doctor when it comes to treating a variety of liver diseases. This Fibroscan machine is the only one in Fresno County, and it's replacing the need for an invasive, painful, and quite frankly, expensive biopsy when it comes to liver disease.
The one unifying thing about all those people with liver disease is how much liver scarring has disease caused.
The Fibroscan uses that scarring and sound waves to help doctors like Marina Roytman learn more about a patient and their treatment options.
So the way it works is really cool. So let's imagine a nice healthy liver, right? So a nice healthy liver will be very squishy. On the other hand, the fibrotic or cirrhotic liver with lots of scarring in it would be pretty hard, like rock-like. So what the Fibroscan does, it generates a sound wave through the liver. And let's imagine the sound wave traveling through the liver. If the liver is nice and squishy, the sound wave is going to take its time to kind of getting through the liver. But if the liver is rock hard, it's just going to bounce right through.
Dr. Roytman says she uses it more as a diagnostic tool. It works in cases like hepatitis C and B, autoimmune liver disease, and fatty liver disease.
It really, in many ways, has revolutionized how I care for my patients. So let's say I see a patient with fatty liver disease in my office. I send them for a Fibroscan. It comes back that the patient only has early fibrosis. So I'm not as worried about this patient. I know, I have time and we can work on diet, we can work on exercise, we can really, we can have some time to reverse the disease.
So typically what we look for when we do this procedure is we're checking for how much fat there is in the liver, how stiff the liver is, if it's pliable the way it's supposed to be.
Sandra Moreno is one of the nurses who operate Fibroscan.
My job is to make sure that what I'm seeing is accurate on the machine as far as the quality of the ultrasound. Once I get the numbers and they are accurate, I then will transfer that to the doctor and give him or her all of that information.
She says many patients are surprised at just how easy the procedure can be.
You don't have to worry about having a ride to go home. You don't need any sedation. You do need to not have anything to eat for 3 hours. That's the most difficult part of it. But if everything goes as planned, it can take a whole 5 to 10 minutes.
In the past, it was believed that the amount of liver fibrosis was unchangeable, but doctors have since learned fibrosis can be reversed. That means this technology not only gives information, it can give hope.
So let's say we can check it again in 6 months after the cure. We can check it again in 12 months after the cure. And the patients find it incredibly gratifying to see that their disease not only has stabilized, but actually regressed. So that's really amazing.
If you're having issues and your doctor's recommending you get your liver checked out, this is a wonderful, easy way to take care of that.
Dr. Roytman says Fibroscan can also be used for pediatric patients to help diagnose fatty liver disease, which she says is a growing problem among American children due to poor diet and lack of exercise.